Moral Scrupulosity OCD. What is it and how does it work? Hi, my name is Dr. Ronald Nicholson, and today I will be speaking about Moral Scrupulosity OCD, a slightly less known OCD theme. Now, I say slightly less known because a lot of therapists are not familiar with all the different OCD themes that exist. If you are suffering from OCD, make sure that you get an OCD specialist as your therapist. Now, what is moral scrupulosity? To answer that, I'm going to go back a little bit. First off, OCD latches on to whatever's going to cause you anxiety. It's just a disruption in the alarm system of the brain, where something causes you anxiety, and so it sends you that signal about that thing over and over again. It's trying to keep you safe. Now, in this sense, moral scrupulosity, that means that the OCD part of your brain is trying to warn you that you might not be a good enough person. It wants you to live in line with your values because on some level, you want to live in line with your values, and that's great. You want to be a good person. The alarm system of your brain is doing too good of a job warning you that you might not be a good person. So you get a lot of intrusive thoughts that are like, maybe I'm a terrible person, maybe I'm a thief, maybe I'm a liar, and you'll do things, nice things, that you actually may often kind of like to try to tell the brain that you are not this terrible person. Those are your compulsions, and this can be part of what makes treating this particular theme of OCD difficult. The compulsions that you're doing are something that therapists call it ego-syntonic, and that means that it's something that you like. The thing is, you're just doing too much of it. For instance, you might remember other people's birthdays. That's great. We all want to be that kind of person that is thoughtful and caring and remembers other people's birthdays. But if you have moral scrupulosity OCD, you might feel a lot of anxiety about, what if I forget? What if I don't do this good thing? And you might go out of your way to an extent that is disruptive to your life to do these good things, like keeping everyone's birthday in your calendar or making sure that you message everyone to the point that it's detracting from the other stuff that might be more important for you to get to. So the intrusive thoughts are warning you that you might not be the kind of person that you want to be. You might not be good enough. And the compulsions then become ways of trying to be that kind of good person that you really want to be, but you're going too far, and you feel a lot of anxiety if you don't do them. So how do we treat this moral scrupulosity OCD? We invite the patient to then live in what I like to call the gray zone, meaning people are flawed. Everyone, you, me, everyone, we all want to be a good person, but we don't always live up to our own values and ideals, and that's okay. The best we can do is just brush ourselves off and try to do better next time. Your OCD, if you have moral scrupulosity, will really give you a hard time anytime you fall short of your values. Working with a therapist, you might train yourself to be okay with not being a perfectly good person. You might intentionally not live up to being perfect. You might go out of your way to do things that are a little bit less courteous without necessarily infringing on your values. You might intentionally not send someone a birthday message on their birthday, let's say. You might not always say thank you. You go further than you typically would with an exposure. The example that I always give with exposures is that, for instance, if you had OCD that focused on germs, you might go out of your way to touch a dumpster. So exposures, you go further than you usually would. For the case of moral scrupulosity, that might mean being a little rude every now and then. Not going outside of your values, but doing something that challenges your OCD that is still okay. Once you get past your initial OCD, then you get to decide who you want to be in your life. And I call that the unaltered path, who you would be if you didn't have OCD. Now, if you have moral scrupulosity, maybe some part of that is something that you want to keep later on in life. Maybe you do want to be that person that makes sure to say thank you to waiters and waitresses or remembers other people's birthdays. And if that's your choice, that's great. So that's what moral scrupulosity is, and a quick overview of how it's treated. I hope this is helpful. Take care.